we have the pleasure of having Urvashi ji, who is the former director of Office of the Vice Chairman of NITI Aayog. Welcome, Urvashi ji. Mr. Bhoobalan ji, who is the IAS and District Collector of the Bijapur in Karnataka. Yeah, and we have Mr. Madan Gopal ji, who is the advisor of the Public Health Administration, National Health System Resource Center, Ministry of Health and Family Welfare, Government of India, who is here online with us. Madan ji, am I audible to you? So I think Dr. Madan Gopal has a meeting and he has to leave. So I will request him to speak first and request him to give his views on the topic of this conference, public centricity, patient centricity, and the importance of the how the healthcare has to become a more patient oriented rather than just the opposite. So Madan ji, over to you.
Okay, thank you, Ravi ji, for accommodating me on a virtual mode, because I know that the other panelists also would be attending the same meeting where I had supposed to attend from 10:30 onwards. So she's also there. I think she would be joining later on. That's one thing. But you have raised a very important aspect about the patient-centric services. If you go back to the National Health Policy, it talks about patient-centric, citizen-centric health services. That means a commitment is there from the highest level in the form of National Health Policy 2017, which talks about citizen-centric services. But we should see that what we are doing for citizen-centric services. Because somewhere our impression has been given that instead of citizen-centric services, we are moving towards the provider-centric services, and more or less all the aspects and other things are provided. It's not the case. If you look at how the things have evolved, one is the quality standards which have been set in. Because if you look at the NABH standards, which essentially are patient-centric, they started right from 2007 onwards. Then the NQAS certification is started in NQAS certification for the public sector. We started somewhere between 15 and 17. So that means these two are there, which are patient-centric. That means how the patient experience and the satisfaction in the public institution improves. That's the whole focus of all this thing. Besides that, over the years, when a lot of data is being generated, we have to now take the step ahead. One is the services which we are providing. The other is how the patients get the best of the care. Because with the use of the technology and other things, we can see that how we can build in the responses, the algorithms, which can be in the interest of the patient, and the centricity can be achieved with that. That's one thing. Second thing which I want to highlight, I think that in the course of the day you would be discussing that, how we can bring the shift towards the patient. He should have an overall experience right from the entry into the hospital to the discharge. How we can make the satisfaction level high in the patient. It right from building capacities of the healthcare providers. Many people are investing into the capacity building activities so that the patients have been made aware about the procedure, they are made aware about the facilities which are available in the institution, and about the care plan and the care. Right now, it's only a one way. That means I prescribe you take. More or less, we are moving in the direction saying that the care plan is now discussed. If you go in from of the private institution, the care plan is also discussed now with the patient. And during the course of the care plan also now, we usually say that what kind of response is the other thing there. That means from just a no test technique to prescription, from prescription now we are discussing the care plan. That's where we are moving towards patient-centric, and that kind of thing has come into the system. Second thing, the other topic is we are trying to now build in the AI technique, that is artificial intelligence, because we have collected so much information. Now we have to put that information so that it can be built towards in the interest of the patient. That's why we are using the artificial tools, intelligence tool. It's nothing but the software which we were been using earlier. So they have been put to use in a more complex way so that they can start reasoning, they can start thinking. And the common examples are the chatbots and other things. The moment you ask a question, they will respond back to that. That kind of thing is also happening, and many way we are doing it. So I think we are moving in the direction from just a no test technique. That means the moment the patient used to walk, when I used to work in the primary health center and community health center, we used to just loads of patients were there, 50, 60 patients in 2 hours you have to see. So what you will do? We used to, the moment the patient enters, you know that what kind of problem he would be having, because many of the other problems can be of minimal nature and this. So that kind, from that thing to the treatment plan, discussion of the treatment plan. You go to any hospital now, they will discuss the treatment plan. We have traveled to that extent, and we are trying to build capacity so that the patient-centric vision which we are having to that is being actualized in the current scenario.
Fantastic, Madanji. Thanks for giving your initial remarks on the subject and giving that perspective of the patient care. And may I move to Urvashi ji and request her to speak about this issue.
Thank you, firstly, Ravi ji, for having me here. Pleasure to always be here, and I'm glad that the topic today is patient centricity, which I think is ultimately what everybody in the healthcare sector, in some capacity or the other, is working towards. So I, of course, I wear a public health hat, I wear a policy hat, but also a patient perspective, being a patient myself. And I think firstly, obviously, it's very important that when we say patient, in the Indian context, there's tremendous diversity that we're talking about. We are not just talking about people like us who are sitting here, but people across the country in the remotest of regions. There's gender differentials, there's socioeconomic status differentials. So when we say patient, firstly, it's a very complex landscape, and ensuring that technology or AI or anything really benefits each and every one of them is where we'd want to be. I think we still have a long distance to go before we can get there, because obviously, like I said, we're a huge population, we're very complex. But I think when it comes to technology, when it comes to AI, it's now been around for a while. In fact, we're seeing even further advances. Now you have AI, you have generative AI, you have constantly the technologies moving forward. But I think what we need to do as a country, which will really benefit patients, is to have very clear use cases of this technology at scale. I think we have a lot of pilots, we have a lot of islands of excellence across the country, but what we need is scale. Because like I said, if you want to reach that patient in a remote area who's still struggling to access the basics of healthcare, then scale becomes a very, very important part of the equation. So if I look at my condition, which is a very rare condition, I think technology can play such a huge role here, but a lot of it is yet to be tapped. Now, how can it do that? Like if I just give a quick example of my case, it's a rare disease, so every doctor has seen only as many patients, with this condition. And it's still under research, it's still relatively not so well understood, So in this case, if we are able to aggregate, data, aggregate the clinical choices that doctors across the world are making for patients of this type, and derive meaningful insights from that, then I think the treatment of somebody like me can be meaningfully informed, through that. So, it's whether we pick up rare diseases and we pick up some other areas, we need to really take them up in a mission mode. And that's what I have been advocating in the policy space. That, we've spoken about AI for a while now. And somewhere I feel that enough scale and equity is still not coming, as it should in a health system like ours. So I think we need those large scale use cases. Rare diseases could be one. We could pick a few others and really see, okay, this is where we can apply technology. And for the end patient, or really at the heart of it all, how does it improve their, whether it's treatment protocols, whether it is how to help them better tolerate their treatment, side effect management. I think all of this can be informed if we're able to make better sense of the data that we have. We know we're a data rich country, but we are moving, of course, towards the digital IDs and things like that. But I think we need more progress, frankly, if I look at it from a patient perspective. If I purely remove myself from the health policy, public health space and see just as a patient, I mean, for me, these are words, AI and this and that, but how is it really helping me? I think still for most people across the country is not that clear. So I think we need to now translate whatever progress we've made into really improving those outcomes at the patient's level. And of course, we already know about improving the efficiency, the outcomes of the healthcare workers also. I mean, that is, of course, another side of the technology, but here we are talking of patients. And so I think I still need to see that tangible benefit as a patient. And if we take up these large 2-3 missions, then I think that might be possible through that.
Excellent inputs, Urvashi ji, and you have highlighted this key. If you remove that public policy space from your side, then as a patient, if you start thinking about how patient care is being addressed in India, I think we are far away from what might be an ideal scenario. So we have our speaker from Bijapur district. He's a district collector, Mr. Bhoobalan, and under him, like several government hospitals and government health initiatives happen. So it would be good to have a view from the local level.
So good morning, everyone. It's a pleasure participating in the event of Elets. So I have participated in few events before, and I always find these events enriching and give me some kind of scope and also insight about the latest updates in the system. So today, good topic is being discussed here, that is the patient centricity, because at the end of the day, the entire health sector works for the benefit of the patient. But these days, there are a lot of challenges and questions regarding this very concept. And I am here to put forward the views and also my experience regarding the public health initiatives with respect to the patient centricity. So I am working in a place called Bijapur. It was renamed as Vijaypura, and it is one of the remotest districts in Karnataka, which ma'am was referring to. So it is around 600 kilometers away from Bangalore in the border of Maharashtra, and the connectivity is also quite less. So we depend upon the public health system. The entire population of 25 lakhs has its major confidence in the public health system. So we have a district hospital, we have 4 taluka hospitals, then we have so many community health centers, taluka health centers, sub-centers, Anganwadi centers, all together catering to the need of maybe 10,000 patients every day at the minimum level to the maximum of maybe 15,000 during the peak seasons. So on an average every month, I can say the public health institutions in Vijaypura district is catering to the need of around 5 lakh people. But what we have been like hearing about the public institutions and the feedback about public institutions is not so good. There is a perception that the public institutions do not give a good service. I am here to like challenge that view, and I want to present a video regarding how the public health institutions in Bijapur district are working, especially my district hospital. So can we have the video, please? In the meantime, I would like to add a few points. So Bijapur district is historically considered to be a backward district because it is located in the northern Karnataka part, and we have lot of aspects to be revisited, and a lot of scope for improvement is there in the public health sector. And one among them is how we can positively inculcate the technology, latest like updates in the information technology for the benefit of the public health. Since we are handling so much of patients every day, we have a limited manpower, whether it is the doctors or paramedical staff or other assisting staff. There is a limitation, and almost all our hospitals are overloaded. In this scenario, we definitely need the intervention of the information technology, which will reduce the workload of our doctors and also other staff. So in this regard, we have taken some initiative in our district. I would like to highlight them. First of all, what we have been doing with respect to the collection of data. So data collection is very important, and in a place like Vijaypura, where the population is having less education, least awareness regarding the latest health issues, where the total fertility ratio is 3.5. We have lot of intervention to do. We have lot of awareness to be created. For that, we need a standard like a system which gives the information related to all the public in the district. We have enough data, but the problem with data is whether you are able to utilize the like data at the fullest purpose or not. That is very important, because every other day we do a survey, every other day we have data collection, but at the end of the day, whether the data is put to positive use or not, that is the major question. So with the latest technologies like artificial intelligence, we are able to like collect the data, accumulate the data, consolidate the data, and we are able to group the data. It is at the level of the patient, at the level of the family, at the level of the village, and at times at the level of the group of villages, what we call as Hobli. So I would like to tell how we are doing it. For example, if there is a scenario of an outbreak, then we will be able to find out through the data that we already have what are the vulnerable population in the district. So which area has been historically affected by this particular outbreak, whether it is malaria or dengue or chikungunya, whatever it is. So which area is prone to these kind of diseases, and which families, again in the particular village, which family is going through this issue again and again, and within the family also whether there is a vulnerable person. So the vulnerability mapping is being done in a positive way, so that as soon as there is a symptom of the outbreak, we are able to reach out to the population in need, and we are able to take the precautionary measures. So it has helped us a lot in controlling outbreaks like malaria and dengue, because dengue, every other day, every other year, it will be a season where dengue will be spreading in the society. So before a couple of years, even I got dengue, and I suffered a lot for over 15 days. So that kind of issue is still in the society. We are not able to completely eliminate issues like this, but how are we able
by the
to...
Karnataka Health Minister. Capacity currently has 626 beds, offering services in medicine, surgery, orthopedics, pediatrics, OBG, ENT, ophthalmology, psychiatry, dermatology, dentistry, Ayurveda, and naturopathy. Handles around 1,000 to 1,500 OPDs and 1,000 to 2,000 IPDs daily. Performs 500, 600 surgeries and 800, 1,000 deliveries per month. Provides free and quality healthcare to all patients. Features a modern OT, CSSD, integrated public laboratory. RT-PCR laboratory, X-ray, ultrasound, color Doppler, 2D echo, CT scan, and MRI services. Offers supportive services like telemedicine, blood bank, in-house pharmacy, physiotherapy, laundry, 24/7 emergency services, ambulance, and security services. Includes an in-house kitchen providing good quality and tasty food to patients. Actively implements in all national health programs. Operates under the Ayushman Bharat scheme, ABAR, covering APL and BPL patients. Offers postgraduate courses in surgery, medicine, OBG, anesthesia, pediatrics, and family medicine, recognized by NBE. Houses a human milk bank, a first-of-its-kind project in Karnataka state government hospitals. Features a 100-bed dormitory built under MP LADS funds by Dr. Sudha Murthy MP. Provides courses like BSc Nursing, paramedical courses, and GNM. Includes a well-organized nutritional rehabilitation center, NRC, PICU, and SNCU. Ensures uninterrupted oxygen supply through PSA and LMO plants. Benefits from Pradhan Mantri Bharatiya Janaushadhi Kendra and provides nutritious food at low cost through Indira Canteen. Currently renders super specialty services like urology, nephrology, pediatric surgery, and oncosurgery through eminent specialists. Awards and recognition. Won the Kayakalap Award in Swatch Ratna Award in 2016-17 and 2017-18, respectively. Received national certificates in 6 departments through NQS and the Lakshya National Certificate for Labor Room and OT. Actively participates in the Ayushman Bharat Digital Mission. Advanced procedures. Conducts advanced surgeries like laparoscopic cholecystectomy, appendicectomy, etc. Sharit T. Bhoobalan IAS, Deputy Commissioner of Bijapur, is the strength behind development of District Hospital Bijapur. Dr. Shivanan C. Mastiholi MD, District Surgeon Bijapur, is a man behind patient quality service.
Mission statement: to enhance patients' quality of life by providing specialized medical treatment and preventive health care at free, affordable cost. And vision statement: to be the network of finest public healthcare institution in state of Karnataka, providing quality medical care services with the state-of-art technology with easy accessibility, affordability, and equity to the people of Vijayapura and beyond.
Thank you so much. So this is just to give a perception that public health institutions also give a better service. They are maintained clean. The doctors there are also very dedicated, and we do care for the public. And patient centricity is our important theme. That's the very concept of this video. So as you have seen in the video, there is lot of crowd, there is a lot of data. So as I was mentioning earlier, how are we going to produce the available data in a better way for the benefit of the society can be done very well through the latest technologies like artificial intelligence. Then the second aspect that we are trying to inculcate is the telemedicine. So again, reaching the headquarters, district headquarters, or reaching the taluka headquarters may not be possible for those who are bedridden or those who don't have a support system, very senior citizens. So for them, the telemedicine concept is being introduced by the government of Karnataka, and we are a pioneer in the telemedicine concept. And we are able to cater to the need of so many hundreds of patients every day. That is not only in the district hospital, but across the district. So we have a dedicated team of doctors. So we have a time slot during which the patients from any corner of the district can give a call to the doctor, and based on the preliminary investigation through the interaction, the doctor will be able to assess whether further reference is required to the nearby hospital, taluka hospital or district hospital. In this way, there are two aspects that we are able to deal. First, the crowd at the public health institutions are getting reduced. So, as per our study, around 10 to 20% of the crowd has reduced because of the telemedicine, because the patients are getting some input at their doorsteps. And there are some patients, even for the slightest of the symptoms, they will get panicked and they will rush to the hospital. So they will assume that they got a heart attack or they got some so-and-so disease. So just to pacify them, we have this telemedicine which is being implemented successfully, such that our crowd has reduced at one side. At the same time, the load on the taluka hospitals and district hospital has reduced at one side, and the time and money of the patient has also been saved. This is one way of utilizing the latest technology that we have. Then the third thing is how we are able to control certain aspects like anemia or maternal death or even infant death. So we have a certain prototype. We have a study which says how well we will be able to predict a particular patient is vulnerable or not, whether the particular woman who is pregnant will be able to have a successful delivery or not. Of course, it may not be 100% right, but we will be able to understand through the existing system algorithms, and through the continuous follow-up, that is very important. We will be able to find out whether there is a strategic improvement in the health of the patient, that is both the mother and the fetus, and whether either of them or both of them will have any issues or not. So these days, the infant mortality rate and the maternal mortality rate have also been reducing because of interventions like the artificial intelligence and the other information technology aspect. So I can keep go on saying so many initiatives and interventions that we can do in the public health sector, and the governments are also taking a lot of initiatives. They are helping us. So Ayushman Bharat Digital Mission is one important scheme that was introduced by the government India, which is catering to the need of so many poor patients, rural patients. So if we are able to utilize all these schemes and programs of the government, the public health will be definitely a boon for the society. At the same time, I would like to reiterate that we also get ample cooperation from the private institutions in our district. We have a couple of medical colleges run by private organizations, but the kind of cooperation is like complementary to each other. So the students from those medical colleges come to our district hospital for attachment from like 3 to 6 months, and we give reference of our patients to those hospitals if we have an excess crowd. So there is an informal arrangement among all these three institutions that whenever there is a need and whenever there is a requirement, each of them will be able to helping the other. So in this way, it is not a competition, but it is at the end of the day the patient centricity that we are looking out. So the public-private partnership will have a major role to play in the public health sector, and I am proud and happy to say that the district of Bijapur is able to successfully run the public health sector with the help of the private institutions, and of course with the team of dedicated doctors, paramedical staff and other like supporting staff under the leadership of our district surgeon, who is also here. I would like to introduce him, Dr. Sivanand Mastigoli. So that is what I would I was expecting to present in this seminar. Thank you, one and all.
Urvashi ji, you have worked at the policy level, and he has talked about the ground level situations. So where are the gaps between the ground and the policy, and where are the uh, future interventions needed in the public hospitals in the field of patient care?
Yeah, so I think, I mean, what he's illustrated clearly is a excellent example, but we need like a million such examples across the country. So I think that is one challenge we face, right? Is just like I said, our sheer scale, our diversity, and also dependence on individuals at the end of the day, right? If there's a great district collector, we see often the transformations coming, but sometimes that doesn't sustain, for various reasons. So I think one is we need that sustainability, that predictability, and the systems. So like he was describing, so many systems that have been put in place, which can then make things run in autopilot a little bit. We'll never be independent of a person. You'll always need, somebody like him, or, the surgeon, or whoever it is, right? But to some extent, we have too much of that dependence or variability based on individuals in governance. So I think that needs to change. The equity needs to come in, because I think southern states are anyway far ahead of the curve. But I think we need to catch up very much to a great extent in many other parts of the country. So, and they are there because they've also invested in public health, and they've invested in public health systems. And like he rightly said, that in many parts of the country, even though we often lament the quality of public health systems, but in many parts of the country, even today, for a patient, that is the only option. It is your PHC, or now we have the Ayushman Arogya Mandirs, or it's your district hospital. So in a lot of regions in the country, you don't have the big urban, the hospitals we see here. You will not see it everywhere. And the organized private sector is still smaller. A lot of it is informal, a lot of it is very small establishments in the private sector, 2-bedded, 3-bedded, 5-bedded nursing homes, or, and that's why regulation is also very difficult. So it is actually the public health system which continues to function. You can, of course, question the quality and the level to which it is functioning in different parts, but we really don't have very much else in many parts of the country still. So we need to strengthen our public health system. And I always say this, that we cannot get away from this. Yes, private sector has a role to play. Yes, public-private partnerships has a role to play. Technology has a role to play, and he's used technology very effectively, as he described in the video also. But we cannot get away from the fundamental, which is our public health system. And I think that is still highly underfunded. It is highly under-resourced, as he said, the shortage of personnel. So we cannot get away from that. And I think, of course, the central government has to step up in this. We have the budget just around the corner. I hope we see something good for the healthcare sector, because we really need it. We are still spending too little, and I've been saying this now for years and years, that yes, the efficiency of your spending matters. Of course it matters. Yes, technology will help to cut costs. But we're still, for such a large country of 1.4 billion people, we are spending way too little on healthcare. And if we want to be Viksit Bharat, we are talking about 2047. The pillars of your workforce are health, education, and skilling. And if you don't have education, health, you don't have public health, it's not going to happen, So I think it's really not, I would say it's time. I would say it's over time that we actually realize that. We need to realize it as of yesterday. Like I said, some states are ahead because health is predominantly a state subject. So the southern states doing far better. But I think the rest of the country has a long way to go to catch up. And we have to increase our investment in public health facilities. That has to be the backbone of the health system. And then, of course, private sector comes in, you have the partnerships, you have everything. But we cannot get away from that responsibility. And I think from a patient perspective, because I deal with poor patients, every day pretty much, I know that that is still a huge need, and so we have to invest in our public health, and financially, HR, technology, all those elements need to come in there, and such islands of excellence we need to have across the country.
So I think in the interest of time, like I'm able to end this session. Although like I am very much tempted to, in fact, continue this discussion much more. And compliments to Bhoobalan ji and Shovanan ji for the excellent video. I think it was an exemplary one. I think he deserves a big round of applause from all the audience. Yeah.